An awesome panel. One of the things that this forum is trying to do is think about these issues not with just one form of violence. And although we talked in this opening panel mostly about gender-based violence, we're going to other forms later. But I would encourage us all to think about this platform for other forms of violence, for other issues around social norms. I was thinking to myself, in part, all of the fear of immigrants all around the world, maybe in part because we fear other people's social norms, that they'll bring social norms that are foreign to us, that we don't like. And some of the anti-immigrant violence, actually, that gets played out in various forms, you know, may be in part related to that. And so this kind of work may have some implications there. I also think in terms of in this country, because we're part of the world, some of the issues around some communities feeling like people are imposing different norms on them. For instance, on the use of physical discipline for children, raising children. That there are many groups in this country that feel like if we suggest other parenting measures, that that's imposing some other group's norms on them, and that's a method of power and control, and feels oppressive oftentimes to other groups. So just some thoughts in terms of starting the discussion, how we use this fabulous panel's base, and think strategically about ways forward. Also, we welcome questions, obviously, to any of the panel. You can address any of the panel. And we also, the one thing is, we do welcome suggestions for ways forward, but please no speeches. So that, enough said. Patrick, I think you get first comment.
Sure, thank you. Those were wonderful presentations. I noticed, Lori, on one of your slides, you had globalization up in the corner, and I guess I'm hearing a lot about communities, and I'm envisioning these villages, but sometimes I don't. My community is larger. There's also a global community. And I'm trying to, I guess, get a better sense of how social norms play out as you become increasingly globalized as people migrate. You know, if you had, for example, a group of people from Somalia or Peru, those, or Ethiopia, I guess, those very high incidence places, and they moved to a low incidence place, would their norms change because they're moving from one culture to another? And are there cultural interventions that maybe not as intentional as the ones you described, but at a national level or global level that seem to have impact? You know, I've seen a lot of norms change around racism, for example, and I'm not sure that it came from highly intentional interventions. I think they were kind of broader societal changes, and I just wondered how that plays in. Can you achieve change at a level other than a village with an experiment? Can you do this, you know, at a national level or global level through other mechanisms?
I think it's a really good point. And I mean, what we know just from observing the world around us, right, is that these things do change over time. And for lack of a, I mean, I don't like the term sort of modernization process, but as what you see over time is that there are certain social or structural forces that tend to change things. So as, you know, greater percentages of women complete secondary school, as women enter the formal workforce, those things change. Whatever. Those things change.
Could you take another mic, please? Take another
Sorry. Those things change people's expectations and their role models and all of that. And in the analysis that we did, for example, where we were looking at 88 comparable studies across time, and we actually looked at macro social factors. So we combined data sets and looked at things what were the predictors at a macro level of local level prevalences of violence. And some of the things that you saw there were exactly that. So it was percentage of women in the paid formal labor force, not just any labor, you know, agricultural labor, that type of thing didn't do it. But seeing women in these more traditionally defined roles seemed to make a big difference. Changing family law. Countries and settings that had family law traditions that were more equitable, you had consistently lower levels of violence. And if you go to that article, you can kind of see, you know, these different measures at the macro level. And so I think that there are things going on in the world that are changing these norms that are way beyond our control and will continue to change them. But I think, I often think about it like the demographic transition. You know, it's like we do know that left, you know, traditional societies that as they go through certain processes and death rates come down, you know, eventually the number of children come down as well. But we didn't rely on that as a global community. We introduced reproductive health and family planning to try to speed up that demographic transition. And I see the work on violence as very similar. I suspect that if we did nothing, many of these large macro social processes would naturally bring some of the violence rates down, not to the levels that we'd like to see necessarily. But I think what we're learning is that we can actually do it in program relevant timeframes with a little bit of effort. And so I think that's a really important message.
Christina, you wanted to add to that?
I, of course, agree with what Lori said. I think there are three issues in what you ask. One is scaling up interventions. You say we don't live in a village, you know, we live in large communities. And I am very, very favorable to soap operas. There are lots of studies about the importance of soap operas. In particular, there is one in Mexico and one in Brazil, in a part of Brazil, that have been fundamental in changing fertility, rate of divorce, so very, very important social variables. The important thing about these soap operas, they were so successful because they depict a typical person, you know, that within those communities, so a typical woman, not somebody like Dallas, okay? And this typical woman goes through a lot of hurdles, lives within scripted interaction that are very similar to those of the people who are listening to them, but there is a change. They go through a lot of hurdles, problems, etc. There is a change. In India, they are doing the same. So I think scaling up would mean present very, very good. I would invest a lot of money, actually, in soap operas. I think they are, you know, my colleagues, academics, look at me and say, what are you saying? I think it's very, very important. The second question is multiculturalism, how we interact with other culture. We see that in Europe, we have this huge immigration of Muslim people, and there is a lot of fear and a lot of anguish what's going to happen to our culture and what not. The interesting thing is that I think there are demographic changes. I think the younger generation will be quite different, provided they are offered a decent education and opportunities. But certainly the older generation, I remember a famous case of a Pakistani man who was living in Milan for 20 years, and he killed his daughter, who was completely, adapted to Italian culture because she had an Italian boyfriend and she wanted to live with the boyfriend. So you have to understand who the reference network is for these people. For the men, the Pakistani man, it was his village in Pakistan. So this is very important to understand, what sort of norms, scripts, whatever they refer to, okay? And the third question, and here I refer to Lori, the question is, are macro variables, and I mean economic, social, political variables, important? I just finished a study on female genital cutting in 28 African countries, and I can tell you that macro variables are not important. Not important. I prove that. I have an econometric model, etc. What is important are social expectations, which tell us that there are interactions there, that it is something, it may not be a social norm, it may be supported by social norm, it doesn't matter, but social interactions are important, and social capital is important. Trust in institutions. These are the two things that most matter to the dynamic of female genital cutting. Other variables do not matter at all. Think of Egypt, that has the highest GDP, the highest level of education, and they have the highest level of female genital cutting, okay? So, I don't think that focusing on micro variables alone may make a big difference.
Thank you, Christina. And in between times, be sure and turn off the mics, otherwise it echoes. We have mics where you can come to ask questions, or you can use the mic at your table, and I will try and scan the room and see who's got a hand up or a signpost up. And so we have two people at the mic here. Go ahead.
Thanks. I'm Gretchen Bachman from USAID, and I have a question for the panelists. I was very intrigued by the idea of looking at the issue of violence more holistically. So, for example, violence against children by parents and violence against women. And I'm just wondering, in the different models that you used, whether it was SASA or others, I know it sounds like with Real Fathers, you looked at how do you work on both issues at the same time, but I'd be interested in how other panelists see this as a potential opportunity to work across both at the same time.
Sure. I think there's a sort of new generation of folks who come either from working on violence against children or violence against women, who are now really trying to program together. And the one thing I can say is SASA was not designed to affect violence against children, but we did an analysis recently that's just come out to look at, well, was there an impact, regardless of the fact that the whole thing was focused much more explicitly on violence and intimate partnerships, and there was. And that doesn't actually surprise me, because the logic of discipline and all of that is very similar. So people actually took the learning and the reflection that they did as it related to domestic violence and generalized it on their own to violence against their children.
Thank you. And Christine might have something too, but let me urge the panel members, Christina and Lori mentioned two different articles. Be sure and transmit the reference list that you have. We can't actually post actual articles per se, but we can post reference lists that speakers provide to us.
Does it work? Yes. We are involved in a project with Innocenti UNICEF on violence, and typically it looks at violence against children and gender violence together. And, you know, this is, we do a manual for every intervention. So what is here is a manual for the Zimbabwe-Swaziland intervention. We are preparing one for Vietnam, one will be for Italy, and another will be Peru, and these are different cultures. So what we look at as common drivers of violence, both, you know, in the case of violence, education basically, violence against children, which is beating children is part of education in many of these places, and violence against women. Are there common drivers? This is a big question. So this is what we discuss.
Jill Gay, What Works Association. My question is for Lori Heise, and I keep learning from you 35 years later. So if Tina Mosoya becomes president of Uganda, where would you suggest, I know, dream on, where would you suggest she starts? So where is the cycle between sort of changing the laws and changing the norms? And where would you sort of start to unravel it?
Okay, so there's two questions in there. Where I would start is I would probably start with I would start with some media-based work using, I mean, soap operas or edutainment or something of that type, together with interpersonal small-scale media and discussion groups in terms of changing kind of social norms at a grand level. In terms of the law and the relationship between law and social norms is there's some really interesting work that I think we have relied far too heavily on the expectation that changing laws will draw people and redefine the boundaries of acceptable behavior. I think there's suggestive evidence that it really depends on what is the social distance between the law and people's social or personal beliefs. So what happens is if it's too big a jump, people nullify the law. They just ignore it. They don't actually believe it, and providers and others, not only does it not help to shift the social norm, but it undermines the rule of law and the credibility of law. Where it's close, and I would use, for example, or closer, I would use the example, for example, gay marriage here in the US. So the laws were staying just one step ahead of kind of the social change in terms of norms. So you had massive shifts in people's personal beliefs around homosexuality and gay marriage. And then the law, I think, because there wasn't this huge thing, could start to actually draw on more positive social norms. So I think it's not just a yes-no answer. I think we need the laws because we need laws. But as a strategy for shifting social norms, I think we have to be more thoughtful about where do the norms stand in relationship to law.
Peggy, then we have Susan, and we have Susan over.
Hi, Peggy Murray from NIH. I actually do research on alcohol, but my question this morning isn't focused on that. I think it will come up later, and I know it would be different depending on which country, which part of the world you're working in. But I'm very, very curious to know, all of you, as you go in and start to develop a program, do your basic research, start to develop a program, how do you present yourselves as outsiders working to change, who are you to say you can go in and change a norm? I mean, and there must be, I'm thinking you seem like you're successful at it, so if you could talk a little bit about some of the approaches that you have to doing that, to working, yes, you can start a soap opera, you can pay a company to do a soap opera, but isn't it better if the community itself, if that comes from someone in the community themselves instead of coming in from the outside?
Well, you're certainly right. In the end, change must come from people who must be involved, okay? The important question is that there are two issues here. One is, do we have the right, and this is a multicultural issue, do we have the right to go and say, you have bad norms, these norms should be changed, et cetera, okay? And in some cases, I think there is a moral right when these norms are really obviously harmful, okay? If they are not, this is open, to be questioned. But if we think that something is harmful to the life and the well-being of people, then there may be, some justification on our part about intervening. But this is a very delicate issue, okay? This is one thing. The second is, of course, people to change must have reasons to change. And so the important thing, for example, I always work, we do, training and consulting in a lot of different countries. I don't do interventions, but I give ideas about how to do policy intervention given what I learn. We always work with local organizations, local people, local ethnographers, let's say, to understand the culture, to understand what people believe in, to understand how to talk to people, et cetera, et cetera. But certainly you're right, the change must come from people, and so discussing, what they do, the soap operas, the good ones, are based on their life, not on our life, etc. So presenting models of alternative behaviors. And I think the most important thing, what you want to change, is change schemata and script, because often you can change a social norm, the script stays the same. Women work, but they do double work now. They work in the family and they work outside the family. So the important thing is to identify what needs to be changed. Maybe you do small change, certain social norm can be changed, but the script will stay the same. So for me, the most important question is what are the drivers of script change? Okay, in your case is violence. And Laurie said very well, there are a lot of supporting norms. There are a lot of supporting values that you must be aware of. But I agree with you, the change must come from people, not from you or me.
From sort of a practical point of view, when we began working in the North, it was maybe a few months after the IDP camps had closed, and I recall going in and having like a stakeholder meeting with all the people, and they were at first very kind of negative. Why are you white people coming here to tell us about gender? We've had all of these NGOs in here, during the war, telling us what human rights are and what gender is, and we don't want to talk about that with you. But what we did, of course, we have also partners on the ground, not just the CARE and the Plan and the Save the Children, but also their local partners, their community implementers, and then start really a process of engagement and discussion and dialogue. So we had a technical advisory group, we had the religious elders, we had the community leaders, the civil people, but also the Caracholi, the clan leaders, start kind of the journey with us. And they were very much a part of guiding the research, deciding where it would take place. Of course, they didn't really review the tools, but they definitely vetted the topics that we were going to cover. And I think the trick was really finding, some of these norms were not working for them. They were not functional in the new world that they were living in. And they identified that, and they said, we do want to change. We have these goals for our communities, and we would like to achieve that within our cultural mind view or cultural mindset, and help us to do that. So kind of trying to find where we have areas of overlap, where their vision for their communities are aligned with what we were frankly paid to do. So find that overlap and then work together with them, all the way through the intervention, not the formative research and the design, implementation, evaluation. And now those leaders are in the process of scaling that up, without additional funds, putting it into their government structures and their organizational structures. I just wanted to say one little comment about place to start that we haven't talked about very much are, I think, religious organization and religious structures. So much of the root of a lot of what we've been talking about this today, and I had to cut out some data I had on that, is really related to what people are learning and understanding in their faiths. So, if we can work, at that kind of formative stage, I think we could have very far-reaching effects. But a lot of people don't want to do it because it's maybe seen as difficult, and if you're an outsider, you really can't do it. You have to be an insider to have those conversations.
Thank you. We have 4 more people who have indicated a desire. Oh, we have a 5th. Okay. And that's all we have time for, because we want to, if we wrap at noon, that's still 15 minutes behind time. We will have time over lunch for interactive discussion. So we'll go here first, then Susan, then there, and I'll have to be quick and only one panel for a minute or two.
Thank you. Hi, my name is Doris Bartel. I'm from CARE. Fantastic panel, you guys. Really awesome presentations. Is the mic not on?
I think you're not talking into it.
So thanks so much for a great presentation. Really appreciate all of the insights there. My name is Doris Bartel. I'm from CARE. My question is about the pace of social change. This drives my work and gets me up in the morning, and I'm really glad that that was mentioned as part of our discussion this morning, is how do you drive social change forward in a positive way as quickly and efficiently as possible. And I'm wondering if an appreciative inquiry approach to all of the examples that you've been sharing here can help us tease apart what works, what are some protective factors perhaps, or some characteristics at the community level that can help us understand how to drive that change forward more quickly. And I don't know, maybe it's just a hunch that somebody has about what it might be. Christina, you mentioned social cohesion or social kinship networks. Maybe that's a clue to a hunch that might be useful in thinking about an appreciative approach to what's protective. So any advice or hints that you might have? Thanks.
Identifying the network is crucial, okay, because norms and company are not universal. They are locally based. So you want to change them, you change within a network. And, there are very simple ways to identify a network, so you can do that. One thing that is very, very important if you want to change scripts, there are theories that have been, applied, how to change scripts. And of all those, the bookkeeping method seems to be the most relevant. And I read it, revision is a gradual process of tuning in with new discrepant information. And I tell you why. Because typically when you do this work, you don't take into consideration some psychological biases, cognitive biases we all have universally. And one is a confirmation bias. So I observe some different behavior and I box it in, oh, this is a very special case. This is a different woman, okay? This is the exception that confirms the rule. Okay, so you work against all these biases. And in my view, the bookkeeping model is the best because it presents, and that's why I talk of soap operas, over a long time, a very different model of behavior. So it has to be a long time, it has to be different, but not that difference that people cannot identify with it. This may solve some of the cognitive bias we all have in receiving new information. Okay? This is very quickly. And I want to know, actually, from people who work in the field, how this actually works.
Thank you. Susan?
Echo the appreciation for the panel. I wanted to make just a quick comment to further what Lori said about the law reform question. And I think this is based on some previous research also done out of the Innocenti Center some years ago, but where it depends how law is reformed and whether law reform is actually sort of embedded in a process of social change as opposed to a couple of people sitting in a dark room and drafting a law. But my question to the panel is, and all of you actually, in the humanitarian context as well, but what in the last 5 years have you seen in your work, to pick up on the last question, would either accelerate what it is that we know or feel needs to be done, and what's the biggest change that you've seen and that's challenged your own thinking and your own work in this area?
good question. If you give me a month or two, I'll be able to give you a good answer. But so it's been very interesting over the last year, especially as I've been working, I think, more and more in the humanitarian context. And you know, the reaction people have that might be too tough of an environment to work in, and there are many complications. But I have seen that this may be a place to really dig into this primary prevention and social norms, because believe it or not, some of the systems are best in these humanitarian settings. You know, the sectors are there. There's healthcare, there's psychosocial support, there's economic. So I think that this is, and it's also a time of a lot of migration, a lot of changing in roles of women in the household. I'm not saying that, you know, this is a happy time for many families, but I think that some really concentrated efforts to build primary prevention in these settings, and because it is the IDPs or the refugees, but the host communities around them that are also very influenced by what's happening. I would like to see, and I would say that my focus has changed. I really like working in this area because I think you can see a faster movement than in some of these other areas that we're working.
Susan.
Susan McCormick Hadley from the Worldwide Network for Gender Engagement out of California. I've spent a fair amount of time in Tanzania. I would love to know who else has been doing work in Tanzania. Oh, great. Lori, I know you, okay, fine, I'll talk with you a little later. We're applying for a grant from a foundation. We are connected with a partnership in Bukoba that I've worked closely with. I serve on their board, to be able to go through the medical clinic and work with patients who come through for care. That's our setting, and we don't know yet what analysis we don't even know yet what questions we will ask them. So I'm dying to talk to anyone and everyone. Thank you.
Is this on? Yeah. I'm Linda Sussman. I'm coming from USAID in the Office of Population Reproductive Health. And we've focused a lot on supporting intervention research at this point because our funds are limited. And there's a lot of violence throughout the world. And I really appreciate the information that you've shared today because it begins to provide us kind of with a normative platform upon which to discuss this. So I just wanted to add and ask you all about the information or your experience and what you're thinking about how we in fact scale up to reach global or even national or more widespread effect. And what are the costs of that? How do we do that in the most efficient way? Do we get to a point where we can achieve a certain scale and then we reach a tipping point where we don't have to continue to intervene to affect norms because the community itself will take those norms on and they will be automatically spread and diffused throughout the community? So I just wanted to add that, the scalability, the sustainability of change into the dialogue and to get your reflections on that. Thank you.
Okay, go on.
Okay. We work a lot nowadays on sustainability. So how some change is sustainable. One thing, and I tell you a little thing, I had a comment on Nancy Glass. On what she said, what I think it was very, very interesting. So what we propose to do is have surveys, vignettes, gather data before, during, and after, and not 1 month or 2 months, but 1 year, 2 years, 3 years after an intervention. And this is very important. I'm doing that with sanitation, for example, because there are lots of failures Okay, there are people who adopt latrines in the villages, and after 6 months, they go back to open defecation, and the question is why? Was the initial survey a good one? Was it not? So I think gathering data is crucial, and gathering good data is absolutely crucial. And my comment on Nancy, I was very impressed by your result. But the question is always when you gather data, there is a social desirability bias. What does it mean? That you work with a community and the community, absorbs what you say. And when you ask about their personal beliefs 6 months later, you may have a fantastic results. Let's say from 10 to 90% agree with certain new behavior. You have to incentivize truthfulness. How do you do that? You do that with the idea of normative expectation. So basically what I ask people is, okay, I have gathered personal information from all the people, let's say, in the village. Now, please guess what the majority answered about this question. Because you want agreement about what the majority answer. If your guess is correct, you get a prize. You get a lottery ticket or whatever. Okay, we cannot pay, but we do that. And this is very important. This is a third step. So you gather personal belief, but then you have to gather normative expectation. You may be surprised that they may be very different from the personal normative beliefs. This is very important. Again, this is an example of how good measurement, should be conducted, because sustainability is related to measurement, because then you may find that it's not sustainable, and then, oh my God, what did we do wrong? Okay, this is crucial.
Thank you. I know we have two tents back in the way over there. Let me give you quick mic access. I don't know who. Lee is one.
Got it. I was intrigued by Jackie's comment about that in this country, the issue of groups feeling that you have no right to impose your beliefs on us is so crucial in so much of what we're encountering. You've done, all the research you've reported on has, thank you, has not been in this country or other countries where that's more likely to be an issue. I don't know how U.S. compares to other developed countries in this respect, but I think we have very heightened sense of you can't tell me what to do. And we've seen this in many domains, especially it's huge in education right now. So does the fact that what you're reporting on comes from other kinds of societies, is that because that's the only place where you dare do these experiments? Or can we learn how to use what you've learned in a very different kind of context that we have in this country?
I mean, I would, stepping back, I think we all work where we work because we come out of a movement to try to end violence against women and children, and so these are settings where it's incredibly high. I think there are definitely lessons to be learned, and there are definitely norm-related pieces of violence problems, and including domestic violence problems here in the U.S. I don't think they play as big a role, though. I mean, I think if you actually look at the kinds of things that we are speaking about in this panel, you would not find if you went and did this work in the U.S. I mean, it's not normative. It is not acceptable. It is okay to talk to other people about So I think it's important to recognize that the drivers of violence at a population level, okay, are different in different places. And so part of the key thing that I've learned from doing this work is the diagnosis piece. Is the diagnostic of what is really going on where you're going on. And if you remember my chart, my little thing, it said, sometimes norms are super important, and sometimes it's other elements, and sometimes it's developmental, or it's even psychological problems. I mean, we have to get the diagnosis right of what is driving the problem in the setting that you're working in. And we're working in very similar settings. And our analysis of what needs to be done, I think, is very much informed by that. And if you ask me what I would do in the U.S., I would have a different answer.
And we do have a bit longer than I thought, Evelyn tells me. So the person that was at the mic before.
Hi, my name is Hope Wilson. I'm from the Salvation Army National Headquarters. I have a question for Rebecca. You were talking about how women accepted violence as a way of being part of the norm or being loved, even, because I've heard that as well. And I was wondering, in terms of changing the norms, how are you planning, or how are you thinking of addressing something like that, where actually women themselves see it as it might play a positive aspect in their lives?
So we didn't, although I have seen it in other places, we didn't really find the part about if he beats me, I feel loved. It was more, that's the appropriate consequence of breaking or violating my gender role or that script. So what we're doing in these particular projects is trying to question about the underlying script. So what is the role of a man and a woman, and who makes the decisions in the family, and so kind of trying to work at that underlying beliefs and attitudes that then fuel those normative expectations. So if their understanding of if a good wife doesn't need to be obedient and isn't responsible for cooking the dinner because the man is also, then the expectations around that will change. So that's how we've been working on it. We're working with both men and women in both of those projects.
Yeah, and interesting, in this country from adolescence, we do hear that, he hits me because that's a sign of love. That means he cares enough about what I do. It's a sign of commitment, as much as of love. But anyway, we have one more in that side table.
My name is Tani Adams, and thanks for sit back down here. So, I work in the field trying to use this conversation to extrapolate to other kinds of violence, which is your challenge in the beginning. Thinking about violence in the context of more broader social violence. The first confusion that, when I was just trying to think back and forth with my notions and what I was hearing, was with Christina's notion that violence is a reaction to violated expectations. And I went straight to what Gilligan talks about as violence as a response to shame, right? It's a reaction to a feeling of shame from his work in the prisons, which has enormous resonance when you think about violence as a reaction to notions of a sense of inequality, of being thrown out of the system, of not counting as a human being. So that's one initial disconnection to the next set of proposals that you make, because violence as a sense of reaction to violated expectations assumes it's something that we all share. Yeah, in the traffic example, for example. Let me just follow through and then. So if the norm that people have is a negative norm, like I don't deserve, my norm, for example, is I don't deserve to exist, right? In this case of a prisoner or a kid in the gang in Central America, the kid's expectation is I'm going to die when I'm 20, so who cares? My life is worth nothing. My society has told me what my life is worth nothing. so I'm out of here, right? And I'm going to blow up everybody before I leave. So in these contexts, you know, part of it is what Lori was saying, is we have to think about it in terms of these other factors, right? But just talk through with me a little bit how the norms approach might work in this. I don't know if the question is clear enough, but how do we approach it? I'm sort of curious what Lori would say and Christina, because the basic notion of violence to me was, I didn't get it.
Thank you for asking this question. I was very brief given the time, but I said as a proviso there are many different types of violence, and certain type of violence are clearly related to violation of expectation. But even your example with shame, okay, I am shamed and I react with violence. Again, why am I shamed? What am I doing that brings shame upon me? And again, it must be there are some expectation for the ideal behavior of a man or of a woman or whatever is XYZ. I am not doing that, so I feel ashamed and I may react with violence. So there is basically a psychological chain in which expectation play a role. It may not be other people, sometimes I talk of the norm within me, okay, because it may not be maybe other people's expectations, or I may not consider them openly, but it may be expectation about myself, and shame is typically a social emotion. It's very different from guilt. Okay, I am ashamed because I am violating some social expectations about me. So in that sense, there is still an expectation which has been violated. But again, violent behavior, certain type of violent behavior may not be norms at all, but may be supported, and I believe they are supported by social norms of other nature that help, okay, engender certain expectation that then result in violence. Because when you think of aggression, okay, aggression, in certain cases is just immediate. Some people are crazy. But usually when people become aggressive, they feel they have a reason to be aggressive. They feel I have a reason to be angry. And what is the reason to be angry if not that something that should be there, that should have been happened, did not happen? People get in experiment, people get very angry if they are not given a fair share of points. Why? Because they expect fairness. In our culture. In other culture, they don't get angry and take like 2 points instead of 5. Why? Because they interpret the situation very differently. So it depends what we expect, and again, what we expect depend maybe on social norm, but more generally on the script with which we interpret the situation. Have I been clear? Okay.
Anyone else? Any comment on that?
There is somebody there.
Go ahead.
Thank you. Absolutely fabulous, really thought-provoking. We've spent some time talking about measurement of norms, and to measure something, we have to understand what it is. In my head, I'm still sort of grappling with what exactly are norms, because on the one hand, we were told they're almost psychological in nature. They're mental maps of deeply ingrained cognitive structures. On the other hand, it seems like norms are our culture. Norms are our beliefs, norms are our values. It's what makes a village, a community, human beings. And so I just want to get some sense of clarity on what is it that we're talking about here. Thank you.
I take it. Okay. Again, if you look at tab 4, we make a distinction between norms, social norms, descriptive norms, traditions, customs, etc. Now, let me go a step back and say what norms are. Norms are rules of behavior, okay? Now, there are many rules of behavior that are not social norms. open defecation is a behavioral rule, but is not grounded on people expectation. I go and do my stuff behind a bush because it responds to certain needs, and we all in a community have the same needs and the same means to satisfy the needs. Does it mean is a social norm? N-O. No. Okay? So social norm is a rule of behavior that is supported by two types of expectations. Empirical, so in my reference network, most people do that. Reference network is crucial. Normative. I believe that most people in my reference network expect me to do that, think I should do that, okay? Plus, I have a preference for behaving in that way because I have these expectations, so they have causal power. Now, let's come to measurement. Typically, the concept of norm has been used in anthropology, sociology, etc., in very vague terms. What I did is give very precise concepts that can be measured. You can measure expectation. You can measure conditional preferences. So you can measure and diagnose, is this a social norm? Is this something else? Is it a convention? Okay? A convention is based on mutual expectation, like traffic rules, but certainly there is very little normative there. Okay? Or it is a pure custom, like open defecation. Open defecation is a custom, it's not a social norm. When you go out of open defecation and want to introduce toilets, then you want to introduce a social norm of using toilets. But there was none before. So a social norm is a rule of behavior supported by certain specific expectation, and when we diagnose what this behavior, this collective behavior is about, we want to measure expectations and preferences. And these are easily measurable, okay? As I said, Nancy has done a great work. There is a little step beyond, the normative expectation I believe about other people's beliefs, but basically what she did is fine. We don't measure attitudes because the concept of attitude is very vague, and we want a very precise measure. We measure personal beliefs, we measure normative expectation and empirical expectation. And then we give vignettes or survey that measure how much this expectation influence behavior, i.e., do norms have causal power or not, period. And this is all the work I do on measurement, basically, okay? And this is crucial, because you may think, oh, this is a social norm, and enact policies that are a disaster, because it's not a social norm, okay?
I'm going to give an easier answer. Just because I sort of go between the world of program and academia, and I think some of the distinctions which theoretically are important don't really matter as much for our insights for programming. So to me, the real question is this a rule that is held in place by my sense that other people expect certain behaviors from me, right? So is it social? Is it a rule that's held in place because I just believe it? And is there a sanction? Is there something positive or negative that happens if you break it? So it might be, for example, that I'm a young girl in a setting, and I actually think it's okay to sleep with my boyfriend. But I know that the people important to me are going to judge me or gossip about me or think less of me and my faith community and my family. That's a norm. And one of the reasons I comply, why I might, or at least I feel guilty if I do it, is because of those social expectations. And I think that's the difference. Is it individual, or is it actually that I'm doing something and I feel pressure from others, and that's a collective? And when we talk about a reference group, that's like, well, who matters to me? And it may vary by different different behaviors or different actions. So in one setting, I might really care what my faith community thinks. And in another setting, it might be my peers that are driving it. So, that's why we say you got to think about whose opinion matters for that particular rule of behavior.
Okay, I want to thank the panel. If there's one more burning comment that anyone wants to make, I do have. Really? I do have no's. As a forum member, you do, if you would like to say something before I make my final comment, feel free.
Well, I was potentially going to just try to take us back to maybe where we started, because I have to say it's been absolutely an incredible discussion, and I feel like I've gone from clarity to mud and maybe back to clarity again. But, oh, and by the way, I'm Michelle Maloney, Kids with Together for Girls. And so I guess my question is to kind of go back to some very basic pieces. And one really for me is, what is the relationship between the value of an individual and the use or quantity or prevalence of violence and the interface between those two? So many of us who came to this work out of the gender equality lens, which was indeed the lens that drove much of the violence work for the last probably 10 years at least, really thought that if we could increase the value of a woman from being lower than a cow, that in fact you would end up reducing the levels of violence. And now that we're also now understanding the distinctions between child abuse and child discipline and IPV and all of these different nuances, I guess I want to get back to this really fundamental question, which is, if we increase value, can we and do we reduce violence? Or do we have to really look at violence in and of itself outside of necessarily the question of value and worth?
And I think that's a really important point, and I know Lori could say something too, but I do think some of Lori's work showed, and some early work that's been done elsewhere by others, that it's not only gender norms. It has to be the norms around when it's acceptable to use violence. And I also think that we can't lose sight of the fact that even in settings where there's a lot of use of violence, that no matter whether everyone subscribes to those same norms, not everyone is using violence. And that, the endpoint has to be behavior here. And we know that norms do affect people's use of violence, but it's not the only thing. And I go back to Christina's early, that anger emotion that sometimes we dismiss. You learn to use violence and when it's okay, and you can unlearn all of that. But I think we cannot totally dismiss that, especially in terms of what we know now about the science of trauma, that traumatized individuals, oftentimes the cortex and all that nice stuff you learned in your group and all that stuff is totally bypassed.
Yes, exactly.
And that, you can, and people oftentimes ascribe it to anger, and that anger when a norm is violated, but without recognizing how much that trauma pathway in the brain can take over no matter what you've learned. So, I think that's one additional piece to all of this that we have to, consider and think about in terms of our interventions. So I don't know if anybody on the panel has one last thought before Evelyn gives us our luncheon marching orders.
Studies, because I still do a lot of lab studies about drivers of moral anger. Okay, so I show you a video of a child who's been bullied, let's say, and then I ask you various questions and I ask you to do certain things, okay? And there are, you're right, people, so we measure traits and we measure states. And the trait, for example, suppose you have a trait, you are very easily angered. This is what you say. There are people who are very easily angered, okay, and then there is a state. You see this little movie, and most people will be obviously angered. The interesting thing is that there are people, and I can give you the percentages, there are people who have anger-based traits, so that are more easily angered. So it's a character trait, okay? So as you say, there are people, for example, that have been subject to trauma that are much more easily angered than me or you, okay? So again, it has to do with expectations, but they interpret the situation in a very skewed way. So there is this fact that somebody has been educated, let's say, in a very violent environment, they will be much, much more easily angered. We know that. So a character trait is formed, okay? This is a problem. So you're absolutely right.
Anyone else, a final comment here? All right. Thank you very much, panel, for a very rich discussion and great ideas for going forward. Evelyn, you want to give us our lunch directions?
I would very much appreciate that.
Hi, thank you so much. And today is day one of a two-day program that's going to evolve. We have very diverse panels, presentations, and at the end of the day tomorrow we'll be doing a panel called The Way Forward and bringing this information together. And so what we wanted to do today at lunch is to engage you all here in the room and those watching the webcast in a dialogue. And so up on the screens, you'll see groups that are being identified, and you've been assigned to a group. And we'll begin with one over there, 2, 3, 4, 5, 6, 7, 8, 9. Was that right? Okay, just like this. So one's over there, 9's there, and figure it out. And there are going to be forum members at each table. And so you can search out names as well. So what I'd like you to do is I'm going to give a few minutes of instructions, and then we have a box lunch outside waiting for folks to pick up. We'll take a 10 to 15 minute break because we haven't had one yet. And then when you come back to your table, there'll be instructions at your table. And you know, what I'd like to do is I'll come back and read the questions. Well, they're right there. That's very convenient. Okay. We have a very diverse group of folks. We have folks who are doing research from academia, who are doing policy work. We work in very different areas as students, direct service providers. There are funders here. So these questions are framed in a way that I use the word environment because I want that to be broad. Wherever you work, play, the community that you're in, as you work through these discussion questions, think broadly with your own experiences in the community you work for, work in, live in. And I think that that's pretty much it. Please come back in 15 minutes and we'll get ready to go. And thank you so much to our panel again.